Just imagine if you're a doctor and you're able to use your personal assistant on your phone to unleash data to a clinician to start informing clinical decision making. So I'm working at Great Ormond Street Hospital because in my day job at KPMG, where I work in other sectors like the financial sector, I see artificial intelligence systems deployed very quickly across an organisation. I really wanted to understand why these technologies aren't being deployed across health and social care. And I thought the best way to understand that is to volunteer and go find out. I'm hugely passionate about the use of artificial intelligence systems within our healthcare service, and I think it will truly revolutionise healthcare.
The Drive unit is our digital research and informatics unit for the benefit of developing data and analytics and technology for healthcare. For example, we're starting to explore how we may be able to use robots in clinical care to engage with children, and lots of things around augmented reality. The COVID-19 emergency, I think, has really highlighted the value of understanding data and the value of big data. And these kind of collaborations are particularly important at this period in view of the fact that we can leverage the expertise from people that are used to working with data, and from our perspective, to help them to understand the unique factors around healthcare data and running a healthcare organisation.
Imagine a clinician's in clinic, they're considering different options around how to potentially treat a patient, but maybe that patient has a rare disease, so they don't really know the outcome for that particular patient. Is literally for them to use their personal assistant on their phone like a chatbot and say, please tell me if I prescribe this, the outcome over the last 20 years for all patients ever prescribed this, and to have almost a near real-time response and actually leverage this data so that it's usable. Just like a clinician has a stethoscope, it's another tool to help inform clinical decision making. One of the areas where Grace is helping the hospital understand COVID-19 is looking at the patients that were admitted with COVID-19, all the different procedures, medications, because this is such a relatively novel condition, and understanding what were the outcomes for those patients in the long term. And that's a way of looking at data that perhaps the hospital didn't have the opportunity to do before.
I think the healthcare sector is likely to change more in the next decade than it has in the last 50 years, and that's going to be almost entirely due to advanced analytics and AI. So it's a really exciting time that's going to impact everything we do in healthcare. And we're very happy that we have the opportunity to work with companies like KPMG to help make this happen.